the second quarter was, in terms of turnover and profit, a little bit muted compared to the first one. What was that the effect of COVID-19?
Yeah, so what you saw in the first half of the year is in the first quarter, we had forward buying of many healthcare systems. And in the second quarter, we saw the reversal of that forward buying, as well as the impact of COVID-19 on healthcare utilization. That's where we believe that the right numbers to look at are our first half numbers, which showed 6% sales, 19% profit growth, as really reflecting the overall picture for Novartis.
What do you expect for the second half of the year?
We remain optimistic that if healthcare systems continue to perform the way they're performing today in terms of enabling patients to visit when they need healthcare, that we should continue to see very solid sales growth and profit growth. That's why we guided to the mid-single-digit sales, low double-digit profits. I think importantly as well, we're very excited about some of our upcoming launches. So we should be able to launch our new medicines. And most importantly, our clinical trials continue to operate well in the course of this pandemic. So we're optimistic about the second half. The one thing, of course, we'll have to monitor is if there's a significant resurgence of COVID-19.
Novartis stopped the EU approval of Xiidra. What is your way forward here?
For Xiidra, our focus now is in the U.S. as well as select ex-U.S. markets. In Europe right now, there doesn't appear to be a further way forward. When we acquired Xiidra from Takeda, our focus was very much based on the U.S. as well as a few other ex-U.S. markets. Europe was always an upside case. At the moment, the EU regulators are requiring additional studies, which we would not propose to do at this time.
You have stopped studies on hydrochloroquine. How do you stand in the development of medicines for COVID-19?
So we have two medicines now in pivotal clinical trials, one called canakinumab and one called ruxolitinib. These studies are nearing final enrollment, and we hope to have results in the second half of the year, which could show whether these medicines help hospitalized patients for COVID-19. In addition, we have over 20 Novartis medicines in investigator studies right now. And we're hopeful that in the second half of this year, we'll get data on those studies, which could help us find whether or not we take those into larger scale clinical trials. In addition, in Novartis research, we're currently working to find new drugs, completely novel drugs that might be able to use to treat COVID-19. So we're trying to take all three elements of the story. Lastly, we committed last week for Sandoz to provide 15 essential medicines to treat COVID-19 at no profit to 79 countries to really enable those countries to manage the pandemic. So we think we have a very comprehensive approach to responding to this global challenge.